Challenges in cataract surgery in anterior lenticonus, Dr. Pankaj Dongre. Hi, please.
This is on. Now on. Yeah. Yeah. Good morning, everyone. So the topic for my presentation is challenges in cataract surgery in Alport syndrome. Yeah. So these are the abbreviations which I have used in my presentation. So the objectives of my presentation is to discuss the ocular and systemic manifestations of Alport syndrome and to elucidate the different challenges in making the capsulorhexis in cases of anterior and posterior lenticonus. So this was a patient who was from Srikakulam, a student of 24 years old. He came to us with diminution of vision in the left eye, which was gradual, painless and progressive. He had history of right eye cataract surgery done 15 years ago, and also he has recent onset of hearing loss. The family history was not significant. His refraction in the right eye was 2500 and it was improving to 20/20 with this correction, whereas left eye vision was not improving. On slit lamp examination, the anterior segment and posterior segment of the right eye was within normal limits, except he was having the posterior chamber IOL in the right eye, whereas in the left eye he was having anterior lenticonus. This is the slit lamp image which shows that there is bulging of the anterior lens capsule in the center. We performed OCT macula in both the eyes, and what we have seen is there was temporal thinning on both the eyes. The temporal retina was thinned out. So, with these findings, we came to a diagnosis of Alport syndrome. So, coming to the history of Alport syndrome, it was Dr. Cecil Alport who in 1927 described the Alport syndrome in a family members who had hematuria, uremia and deafness. So, as we know, the Alport syndrome, the basic pathology lies in the type 4 collagen, where and this type 4 collagen involves alpha 1, alpha 2 chains in the basement membranes, and these membranes are especially present in the glomerulus, ears, and eyes. So, these three structures are mainly affected in Alport syndrome. So, as these three structures are affected, we will have renal, auditory, and ocular manifestations. The renal manifestation includes the hematuria due to the endothelial cells of the glomerulus are affected, and the space between the endothelial cells increases. Even the auditory, the organ of Corti also has the basement membrane, which also involved in the Alport syndrome, leading to sensory neural hearing loss. The ocular manifestation, it involves the cornea, the lens, and the retina. In cornea, we can see dystrophy like posterior polymorphous corneal dystrophy, which can be vesicular type and can be band shaped. In the lens, we can see either anterior lenticonus or the posterior lenticonus. We will get a oil droplet sign in retinoscopy in these patients. The renal manifestations can be temporal thinning of the retina, which can be seen on OCT, or there can be giant macular holes. So, coming back to our patient who has anterior lenticonus in the left eye, after clearance from the nephrologist, we went ahead and did the phacoemulsification in the left eye. Unfortunately, the video is not available. At 5 weeks, the patient had visual acuity of 20/20 with +2 diopter sphere. And coming to my second objective is to elucidate the different the challenges in performing the continuous curvilinear capsulorhexis in presence of anterior and posterior lenticonus. So, as there is bulging of the anterior lens capsule, to start the rhexis, if we start the rhexis at the center, the rhexis will run away. So, the tip is always start your rhexis beyond the cone, and try to involve the cone in your flap of the rhexis. if you are doing the rexis manually. But if you have other devices like Zepto precision pulse capsulotomy, or you have femto laser available, then you can do a capsulorhexis along with these devices, and you can include the cone in at the center of at the center while docking in the with the femto. So this was a paper where they have published, they have done one eye with Zepto and the other eye with femto in patients of anterior lenticonus. So there are multiple case reports and papers where they have used femtolaser assisted cataract surgery in performing the anterior capsulorhexis in these patients. In pediatric patient especially, they also have the posterior lenticonus. So in posterior lenticonus also, in pediatric patients we do posterior capsulorhexis. So doing posterior capsulorhexis is also difficult in these patients, but if we do meticulously, as we have to do anterior vitrectomy in these patients, if we do meticulously, even posterior capsulorhexis can be done. Yeah, thank you.
Very nicely covered. Any questions? It's a very nicely depicted case. Of course, he could not share the video, otherwise it would have been icing on the cake. Anyway.